Why is it so hard to have a baby? It's a very common question that come from my clients. Let me introduce myself. I'm Dr. Clara Chan, a traditional Chinese medicine doctor, trained and practiced in Hong Kong. In the past couple of years, I've been helping couples who have fertility issues to deal with their situations. I've also helped a couple of them, a good number of them, to go through the IVF process. In the next couple of minutes, we will touch base on the most common fertility issues that we encountered in a modern city like Hong Kong. We are also trying to investigate some of the most common underlying causes. When a couple in their reproductive year have regular unprotected sexual intercourses but still are unable to achieve clinical pregnancy after 12 months or more, the WHO classified the conditions as infertility. The conditions is estimated to affect around 15% of couples in the world. Although most of the clients come to seek help from a fertility clinics are women, infertility is not solely a woman's problem. About 30% of infertility cases are caused by male factors alone, and up to 30% of cases involve problems of both parties. Male infertility is mainly caused by the suboptimal sperm parameters. It may be one or a combination of low sperm concentrations, poor sperm motility, or abnormal morphology. Common factors identified in female infertility include disruptions of ovarian functions, tubal or other blockages, and suboptimal uterine conditions. Many researchers believe that the declining male fertility during this century is mainly caused by environmental pollutions, while age and general health issues of women are major underlying factors for female infertility. In the next couple of slides, I will go deeper into the age factors and most common health-related infertility issues we encountered in actual clinical practices. Age-related infertilities becomes more common as more women choose to wait till their 30s to begin their families. Although our life expectancy has increased, the improved health in later life does not affect the natural age-related decline in fertility. Women's fertility begins to drop in their late 20s or early 30s and falls more rapidly after the age of 35. This is mainly attributed to the progressive decline of the numbers of eggs and also the qualities of eggs. The age-related decline in fertility is also accompanied by significant increases in the presence of abnormal number of chromosomes in the cells and also spontaneous abortions. Various diseases and conditions like tubal diseases, endometriosis, and ovarian cyst also increase with age. All this will adversely affect women's ability to carry a pregnancy to term. We may not be able to defy age, but with proper interventions, we may help the patients to revert conditions like primary ovarian insufficiency, also known as POI. We may correct the hormone imbalance, regulate the ovulations, helping the eggs to mature and release timely. And we may also be able to improve the uterus conditions to favor proper embedment. Apart from age, the cause of female infertilities can basically be classified into three categories, namely the disruption of ovarian functions, blockages, and suboptimal uterus conditions. Let's start with the ovarian functions. The female ovaries produce mature eggs for fertilizations and deliver the hormones which are essential to establishing and maintaining pregnancy. Two most common ovulation issues we encounters in our clinical practices are POI and PCOS. When a woman's ovaries stop working before age 40, she is said to have premature ovarian insufficiency. The conditions affects approximately 1% of women. When this happens, a woman's menstrual cycles become irregular. Her ovaries stop making hormones such as estrogens or progesterone, and she stopped ovulating regularly or not even ovulating at all. Another common ovulation issue is polycystic ovarian syndromes, PCOS. It is a condition in which the ovaries produce an abnormal amount of a male hormone named androgen. Women with PCOS may have infrequent or prolonged menstrual periods. The ovaries may develop numerous small follicles and fail to regularly release eggs. As the whole fertility process starts with a mature and healthy egg, the ability to produce a healthy egg is always the first priority when we come to infertility treatment. Through acupuncture, moxibustions, and herbal medicine, we may help women to regulate their menstrual cycle, enhance the egg maturity, and regulate the ovulation's timing. After an egg is ovulated, it takes up to 24 hours to be fertilized in the fallopian tube. The fertilized egg then need to travel a long way to embed in the uterus. Studies suggested that embryo implantations take place between 5 and 10 days after ovulations. Should there be any blockage in the journey, the released egg may not have a chance to be fertilized nor properly embedded. The most common blockages is in the fallopian tube. The blockage can be caused by a prior operations, ectopic pregnancy, or negations, any type of negations. It can also be a pressure change in the tube due to fibroids in the uterus or other reasons. The blockage can also exist before the egg reaches the fallopian tube. Common causes include pelvis inflammations and endometriosis. Although not all types of blockages can be removed without operations, a good number of them could be treated by reducing the blood clot and flame or enhancing the energy flows in the lower abdominal area. In the TCM practices, we will use herbal medicines and moxibustions to enhance energies and reduce blood stasis. We will also use acupuncture and other manual therapeutic methods to modify the energy flow. When the fertilized egg makes it to the uterus, the implantation process begins. Once the fertilized egg is implanted into the endometrium, it derives nourishment from the uterine blood vessels and eventually becomes an embryo and then a fetus. A healthy uterine lining must be at least 8 mm for the effective implantations of a fetus. In contrast, too thick linings may also compromise the blood flow and may not be most favorable for the fetus. There are a number of conditions that can cause the uterus not to functioning properly and affect the implantations. The most common ones are uterine fibroids, adenomyosis, and some hormone imbalance. From a TCM point of view, the uterus health is crucial not only for conceptions, but also for healthy development of the fetus. We will suggest our clients to spend 3 months to optimize the uterus conditions before planning for conceptions. During this period, interventions will be done to thicken the linings, enhance the blood flow, and minimize the blockage in the uterus. Exact interventions will be done according to the client's body constitutions and health needs. Thanks for joining me for this short talk. In the near future, we will have more sharings on the topics around what is TCM's perspective on fertilities, how do TCM support natural conceiving and fertility, how we use TCM's interventions to support IVF, and how TCM help on male fertilities. I'm Dr. Clara Chan. Hope this sharing is helpful to you and see you soon.